Let's examine the musculature of sole of foot. The term plantar muscles of the foot refers to these muscles. Unlike the small muscles of the hand, the muscles of the sole have few delicate functions and are concerned with supporting the arches of the foot. The muscles in the sole of the foot are divided into 4 layers, with each layer consisting of different muscles that perform specific functions. The first layer of muscles, which is closest to the skin, includes the abductor hallucis, flexor digitorum brevis, and abductor digiti minimi muscles. These muscles are responsible for moving the toes and providing support to the arch of the foot. The second layer of muscles includes the quadratus plantar and lumbricals muscles. These muscles are responsible for flexing and extending the toes and for providing stability to the foot during weight-bearing activities. The third layer of muscles includes the flexor hallucis brevis, adductor hallucis, and flexor digiti minimi brevis muscles. These muscles are responsible for adducting and abducting the toes, and for maintaining the position of the toes during walking and running. Finally, the fourth layer of muscles includes the plantar and dorsal interosseous muscles. These muscles are responsible for flexing and extending the toes, and for providing support to the arch of the foot during weight-bearing activities. All these muscles work together to support the foot and allow it to move and function properly during various activities. Although their names suggest control of individual toes, this function is rarely used in most people. Several muscles that originate in the posterior and lateral compartments of the leg send long tendons into the sole to their points of insertion. The general pattern is like that in the anterior aspect of the forearm and hand. The 4 tendons found in these layers of muscles are flexor digitorum longus tendon, flexor hallucis longus tendon, fibularis longus tendon, and tibialis posterior tendon. The first 2 tendons are found in the second layer, while the other 2 tendons are situated in the 4th layer of plantar muscles. Let's look at these muscles individually, starting with the muscles in the first layer. Here you can see the abductor hallucis brevis on the medial aspect of the foot. This muscle originates from the medial tuberosity of the calcaneum, flexor retinaculum, and the palmar aponeurosis. As the muscle moves distally, it finds insertion at the base of the proximal phalanx of big toe. Supplied by the medial plantar nerve, a branch of tibial nerve, this muscle is responsible for the abduction of the big toe. Next up we have the flexor digitorum brevis muscles, which covers a large area of the sole as shown here. This muscle also originates from the calcaneal bone and the plantar aponeurosis. The muscle then divides into 4 tendons, one for each of the 4 toes, 2nd to 5th toes. These tendons pass through the sole of the foot and attach to the base of the distal phalanx of each toe. Supplied by the medial plantar nerve, a branch of tibial nerve, this muscle is responsible for the flexion of the 2nd, 3rd, 4th, and 5th toes. The third and the last muscle in the first layer of the plantar muscles is called abductor digiti minimi. The muscle originates from the lateral tuberosity of the calcaneum and palmar aponeurosis. The muscle finds insertion at the lateral side of the proximal phalanx of the little toe. It is innervated by the lateral plantar nerve, a branch of the tibial nerve, and is responsible for the abduction and flexion of the little toe, that is the 5th digit. Here you can see the 3 muscles of the first layer that cover the whole sole. You can remember these muscles by this mnemonic: abs flex abs. Remember there are 2 abductors and 1 flexor muscle in the first layer of the sole. Let's look at the second layer of muscles now. It has 2 muscles in it. This here is the quadratus plantar. It is also known as flexor digitorum accessoris muscle. This muscle is separated from the first layer of the muscle by lateral plantar vessels and nerves. As you can see here, the muscle has two slips that originate from the medial and lateral tubercles of the calcaneus. The two portions of the muscle join and end as a flattened band at the tendon of flexor digitorum longus muscle, a muscle of the posterior compartment of the leg. It is innervated by the lateral plantar branch of the tibial nerve and is responsible for the assistive action of flexion of toes brow by the flexor digitorum longus. The second muscle, or muscles to be precise, in the second layer are the lumbricals. There are 4 lumbrical muscles in the foot, one for each of the 4 toes, second, third, fourth, and fifth toes. The lumbrical muscles arise from the tendons of the flexor digitorum longus muscle, which is in the leg. The tendons pass through the sole of the foot, and the lumbrical muscles attach to the sides of the tendons near the base of the toes. The other end of each lumbrical muscle divides into 2 slips, which attach to the extensor expansion of each toe. The extensor expansion is a sheet-like tendon that covers the top of the toes and helps to extend them. These muscles are innervated by terminal division of the tibial nerve. The first lumbrical is innervated by the medial plantar branch, while the rest are innervated by the lateral plantar branch. The main function of the lumbrical muscles is to flex the metatarsophalangeal joints and to extend the interphalangeal joints. Other than these 2 muscles and the flexor digitorum longus tendon, the second layer of sole muscle also has the tendon of flexor hallucis longus. That is all about the second layer of plantar muscles. Let's look at the 3 muscles of the third layer. Here you can see the muscle in the third layer. Let's look at the flexor hallucis brevis first. The flexor hallucis brevis muscle has 2 tendinous heads of origin. The lateral head originates from the plantar surfaces of the cuboid, behind the groove for the fibularis longus, and adjacent surface of the lateral cuneiform. The medial head originates from the tendon of the tibialis posterior muscle as it passes into the sole of the foot. The medial and lateral heads unite and give rise to a muscle belly, which itself is separated into medial and lateral parts as it approaches its insertion on each side of the proximal phalanx of the big toe. The flexor hallucis brevis is innervated by the medial plantar nerve, which is a branch of the tibial nerve. Its primary action is to flex the big toe at the metatarsophalangeal joint, which is the joint between the base of the big toe and the first metatarsal bone. It also helps to support the arch of the foot by maintaining tension in the plantar fascia. Next muscle in the third layer is the adductor hallucis. The adductor hallucis muscle originates from 2 muscular heads, transverse and oblique, which join near their ends to insert into the lateral side of the base of the proximal phalanx of the great toe. The transverse head originates from the plantar ligaments associated with the metatarsophalangeal joints of the lateral 3 toes, and from the associated deep transverse metatarsal ligaments. The muscle crosses the sole of the foot transversely from lateral to medial and joins the oblique head near the base of the great toe. The oblique head is larger than the transverse head and originates from the plantar surfaces of the bases of metatarsals 2 to 4 and from the sheath covering the fibularis longus muscle. This head passes anterolaterally through the sole of the foot and joins the transverse head. The tendon of insertion of the adductor hallucis attaches to the lateral sesamoid bone associated with the tendon of the flexor hallucis brevis muscle, in addition to attaching to the proximal phalanx big toe. The lateral plantar nerve innervates the adductor hallucis, which adducts the great toe at the metatarsophalangeal joint. The third and last muscle in this layer is the flexor digiti minimi brevis. The flexor digiti minimi brevis muscle originates from the plantar surface of the base of the fifth metatarsal and adjacent sheath of the fibularis longus tendon. It inserts on the lateral side of the base of the proximal phalanx of the little toe. The lateral plantar nerve innervates the flexor digiti minimi brevis, which flexes the little toe at the metatarsophalangeal joint. Here are the three muscles in the third layer of the sole of foot. You can remember this muscle with the mnemonic flex, ad flex. This mnemonic is the opposite of the one we used for the muscle in the first layer. Here you can see that the two muscles in this layer are flexors, and one is an adductor. Now let's look at the last and the fourth layer. This layer consists of palmar and dorsal interosseous muscles and the tendons of fibularis longus and tibialis posterior muscle of the leg. Looking at this illustration, you can see that both the dorsal, plantar, interosseous are closely related. These are small muscles placed between the metatarsal bones. There are 3 plantar and 4 dorsal interosseous. The dorsal interosseous are highlighted here. They are the most superior muscle of the sole. All 4 muscles are bipinnate and originate from the sides of adjacent metatarsals. The tendons of the dorsal interosseous insert into the free margin of the extensor hoods and base of the proximal phalanges of the toes. The second toe can be abducted to either side of its long axis, so it has 2 dorsal interosseous associated with it, one on each side. The third and fourth toes have a dorsal interosseous muscle on their lateral sides only. The great and little toes have their own abductors, the abductor hallucis and abductor digiti minimi, in the first layer of muscles in the sole of the foot. The dorsal interosseous are innervated by the lateral plantar nerve. The first and second dorsal interosseous also receive branches on their superior surfaces from the deep fibular nerve. In addition to abduction, the dorsal interosseous act through the extensor hoods to resist extension of the metatarsophalangeal joints and flexion of the interphalangeal joints. Now let's look at the plantar interosseous. The 3 plantar interosseous are shown here. Each plantar interosseous muscle originates from the medial side of its associated metatarsal and inserts into the medial free margin of the extensor hood and base of the proximal phalanx. They adduct the third, fourth, and little toes toward the long axis through the second toe. The great toe has its own adductor, that is, the adductor hallucis. In the third layer of muscles, in the sole of the foot, and the second toe is adducted back to its longitudinal axis by using one of its dorsal interosseous. All are innervated by the lateral plantar nerve. In addition to adduction, the plantar interosseous act through the extensor hoods to resist extension of the metatarsophalangeal joints and flexion of the interphalangeal joints. With the help of this mnemonic, you can remember the number and action of the dorsal and plantar interosseous easily: 4 dab and 3 pads. Capitalized D is for the dorsal interosseous. They are 4 in number as we discussed earlier. The AB indicates their action, that they act as abductors at their respective digits. The 3 pads is for 3 plantar interosseous that act as adductors at their respective digits. So, there you have the 4 layers of plantar muscles that make up the sole of the foot. We will talk about nerves and vessels in the sole of the foot in the coming section. Stay tuned.
Have you ever heard of video books? sqadia.com is delighted to present video books. medical books that have been tailored into a series of videos. sqadia.com videos are presented in the same order as the book's chapters. Explore now and make your learning easy.